So I'm curious to ask you, with all your background and your experience, so how do you manage these athletes? Like, do you combine different techniques? How do you see the use of McKenzie with these athletes and manual therapy? So how do you approach this type of high performance athletes?
Right. So yeah, my foundation is certainly the McKenzie method, mechanical diagnosis and therapy, and that really is my foundation in terms of assessment and in terms of management. And what I've found over the years is that the principles behind the McKenzie method fit really nicely into management of active people, of athletes, whether that's the weekend warrior right through to the high performance athlete. Because I think if we look at the McKenzie method, it is, we talk about force progressions. So we talk about self-management, patient-generated forces, but we also talk about the use of clinician overpressure, mobilization, and manipulation. So it has those progressions in terms of manual therapy as required. So from one aspect, yes, I do manual therapy, but it's part of the context of those force progressions. And in terms of the athlete, what I've found is often we need to look at a strength-based program. But again, that comes into some of the principles around the McKenzie method in terms of management of certain conditions such as contractile dysfunction or tendinopathy, where we do look at a strength-based program, a loading. So it really is dependent on the athlete, what they require. So I always look at the MDT, mechanical diagnosis and therapy, as quite a broad type of management that we are doing with the athletes.